A jigsaw puzzle with missing pieces. Some fell off the table when the box was opened. Some were lost during assembly. Some were thrown away because they were boring. Each scenario changes how you should fill in the gaps. Missing data in biology works the same way. The reason a value is missing determines what you can do about it. The naive approach: delete every row with a missing value and analyze only complete cases. If 10% of patients are missing a lab value, drop them. Problem: if the missing patients are systematically different, sicker, older, from a specific site, dropping them biases every result. In clinical trials, patients who drop it often do so because the treatment isn't working or the side effects are unbearable. Complete case analysis makes the treatment look better than it is. Even when missingness is truly random, complete case analysis loses statistical power. You're throwing away partially observed information. MCAR, missing completely at random. Probability that a value is missing doesn't depend on any variable, observed or unobserved. It's as if pieces fell randomly off the table. A lab machine malfunctions on random days. A data entry clerk accidentally skips random fields. MCAR is the best case scenario. Complete case analysis is unbiased, just less powerful. But MCAR is rare in practice. Most missingness has a reason. MAR, missing at random, is a confusing name because it doesn't mean randomly missing. It means the probability of missingness depends on observed variables, but not on the missing value itself. Older patients miss more clinic visits. Missingness depends on age, which you observe. But conditional on age, whether a specific visit is missed doesn't depend on what the lab value would have been. This is the key. Once you account for the observed predictors, the remaining missingness is random. Multiple imputation can handle MAR correctly by using the observed variables to predict the missing values. MNAR, missing not at random. The missing value itself determines whether it's missing. A patient drops out of a pain trial because the pain score is too high. A gene in single-cell RNA-seq is undetected because its expression is too low. The dropout rate increases as expression decreases. MNAR is the hardest case because the very information you need is the information that's missing. Simple imputation methods fail because they can't access the reason for missingness. You need to model the missingness mechanism explicitly, a selection model or pattern mixture model. 3 common methods that are almost always wrong. Mean imputation: replace missing values with the column mean. This shrinks the variance and weakens all correlations. The puzzle pieces are all the same shade of grey. Last observation carried forward: assume the last observed value persists. For progressive disease, this freezes the trajectory at the last good value, underestimating deterioration. The indicator method: add a binary flag for missing and set the missing value to 0. This introduces a spurious relationship between the flag and the outcome. Use none of these. The mechanism determines the solution. MCAR, complete cases are unbiased but wasteful. MAR, imputation works if you use the right predictors. MNAR requires explicit modeling of why values are missing. Simple methods, mean imputation, LOCF indicators, are almost always wrong. Next, how to properly fill in the missing pieces.